right, so your patient comes with chest pain. Do you admit them or not? So again, very common thing that I probably manage just about every day in my emergency department. Thankfully, we have some great decision rules that help us work through this in some of our patients. And I will say that some of this, just on the medicine side of things, and this might affect how I have the conversation with patients. It depends on what your other patient factors are, so socioeconomic status issues as well as access to care issues. Sometimes the conversation, I might push more for admission for particular patients because I know that their follow-up is going to be very, spotty at best. If somebody has great follow-up, it's going to change the conversation a little bit. But essentially what I do when I'm going through in practice is I'll use the heart pathway to risk stratify them. So using the heart score plus a second troponin. But often, again, as I kind of mentioned in the intro when I was talking about scripting in general, anyone who comes in with chest pain, maybe not like every single person, but the vast majority of people who have chest pain that they have come to you in the emergency department for, heart attack is one of the things on their mind that they are worried about. That's like one of the biggest things that they're probably thinking of or wanting to rule out or being concerned that they might have. So as I mentioned in my kind of first H&P encounter with the patient, I'll bring that up initially right at the beginning, and I preempt everything right at the beginning because sometimes I know just from talking to them like, oh, there's no chance this person's going home. They tell you about their like 8-vessel CABG or whatever it is and how they're on Plavix and how this chest pain is like going to their arm, all the like alarm bell features, there's no chance that person's going home. And I'll tell them that right at the beginning. So it's not like a surprise when all their tests come back. It's like, oh, well, your tests are normal, but just kidding, you're being admitted because that doesn't, sometimes that's hard to understand and they don't, if you haven't timed that right, it can be confusing to people. So what I'll say again, after I've done the initial history and physical, I'll tell them, let's say, so I'll do two versions. I'll kind of talk about the person who, clearly seems pretty high risk, that even if the troponin comes up negative, that I'm still very concerned based on their history primarily or their exam as well, that they might be at pretty high risk and it wouldn't be safe for them to go home, that they probably should stay for at least a stress test, if not a cath. So for those patients, I'll say, I totally get, I'm so glad you came today, to get checked out because this chest pain does sound really concerning. I'm really concerned because you've had all this, these heart problems in the past. It sounds like your family has some, pretty serious heart history in the family as well. And all these things would put you kind of at high risk for having, a heart condition today. Now, there is a chance that this pain you're having is not related to your heart, but I think the risk that it could be is pretty high. So we are going to do some tests here. Most of the time they've already done an EKG for the patient. So we've already had a look at your heart tracing. So from that, I can tell the first quickest thing I can tell is you're not having a massive heart attack right now. So that's great. But what I can't tell yet is could you have had a minor heart attack today, because you're having this pain. And so we're going to get some blood tests, which will help us see that. So we'll get some tests checking out your electrolytes and your blood counts, and we'll also check something called a troponin, which is a blood test for the heart. So if you've had damage to your heart, this thing called troponin starts going up, so we'll be able to see that and kind of be able to tell if you've had some damage to your heart already. Now, if that test comes up negative, that's great because it means you haven't already had damage to your heart. But what I don't know is, do you have some sort of like ticking time bomb in your chest waiting to cause a problem that just hasn't caused one yet? You're having all this pain. Sometimes that can be a sign that your heart vessels are narrow, that something like a heart attack is lurking, that could happen. So in your case, because of this pain you've been having, because of all the risks that you have with your other health conditions and with your family history and everything, I think even if that troponin comes back looking good, which again would be great, I'm still going to recommend that you stay in the hospital today and that we get further tests because, again, the best that we can do in the emergency department is to say, yes or no, have you had a heart attack? Yes or no, has there already been damage to your heart? But the next step to figure out, you haven't had it today, but could you have it tomorrow? We can't answer that question here. But if we admit you, they can do other testing in the hospital that can help hopefully answer that question. So again, we'll get all these tests done. We'll also get you some medication to try to help with this pain that you're having and try to see if we can bring it down. We're going to give you an aspirin as well, and we'll give you a few aspirin tablets because when we've done studies on other patients who've had heart problems before, we found that aspirin is actually heart protective. It helps protect the heart when people are having this kind of pain. So we'll give you that, and again, hopefully get you feeling better while we're waiting for these tests. And then I'll come back and let you know what the results are when we get all of those back. But just so you're ready for it, regardless, we're going to want to keep you in the hospital today. So I would go ahead and if you need to make calls, just plan on that. So that's the person who's going to be admitted for sure from the beginning. And then I'll have a pretty similar version, which I won't go through entirely, but similar version. So if a person who, based on their HMP and based on their other patient factors and the heart score, seems like they're going to be a very low risk patient who can probably go home, it'll kind of be phrased a similar way. So I'll explain, not having a massive heart attack, your tests, let's say all the tests are, or at the beginning, I'll explain, if all these tests come back looking good, then the chance that this is something, related to your heart is extremely low, because thankfully you don't have many other, things that put you at risk for heart attack. Like you don't have diabetes, you haven't had heart attacks in your family, you don't smoke, which is great. So all of those things would put you in a kind of low risk category that you're unlikely to have serious heart disease. So we're going to check some blood tests, and we're actually going to check one of the blood tests we have to check twice. So we'll check it now, and then if it's okay, if you can wait with us for a while, in about 3-4 hours, we're going to check it again. The reason for that is if we pretend, let's say, again, like I said, you're not having a massive heart attack. We can tell that from your heart tracing, the EKG that we did. But what I can't tell is, let's pretend right as you arrived in the emergency department, you had a minor heart attack. Now, it takes time for some of these blood tests to start showing up that there was something, wrong with the heart. And so if we check the test now, and this just happened a few minutes ago, the test might come up negative, but it might be because it just hasn't had time to show the damage. So that's why we repeat that blood test in a few hours. So if we'll check it now, if it comes up negative, that's great. We'll have you hang out, watch TV for a little while. We'll try to get you feeling better. And if the second test also comes up negative, then that means the chance that this was related to your heart is extremely, extremely low, and it'd be okay for you to go home, that we would have ruled out that this was anything heart related. And if that's the case, then we will want you to follow up with your primary care doctor, but we'll chat about that once all your tests come back. All right, and that's how I have those conversations.